Welcome, future nurses. This is Nurse Camille at Nursing Survival. This episode is all about meningitis. Go to nursingsurvival.com to get the study guide that goes along with this episode. I not only have all the information on a one-page guide, but I also have fill-in-the-blank guides and coloring page guides. You can color and learn at the same time. So what is meningitis? It is an inflammation of the meninges. They are the membrane that surrounds the brain and spinal cord. They include the dura mater, arachnoid matter, and the pia mater. The most common forms of meningitis are transmitted through direct contact, including droplet spread. Occurrences are prone to high populated areas, crowded living areas, schools, and prisons. Meningitis can be caused by bacteria, viruses, fungus, and parasites. Bacterial meningitis is commonly caused by meningococcal or Neisseria meningitis, pneumococcal, or Group B streptococcus. Newborns normally get Group B strep. Viral meningitis includes herpes simplex, varicella zoster, mumps, HIV, and influenza. Fungal meningitis is rare. Anyone can get it, but people with weakened immune systems, HIV, cancer, etc., are at a higher risk. The most common cause is cryptococcus. It is not contagious from person to person. Protozoa or parasitic meningitis is also rare. It is spread normally by ingesting something that has been infected by the parasite. Meningitis can occur whenever there is an opening or trauma to the brain or spinal cord. Skull trauma, cerebral shunts, cochlear implants, and anatomical defects are some examples. Patients that are immunocompromised or have other medical conditions such as cancer, lupus, or HIV are at a higher risk for developing meningitis. Signs and symptoms of meningitis include nuclear rigidity or neck stiffness, severe headache, lethargy, malaise, memory changes or confusion, short attention span, personality or behavior changes, flu-like symptoms including fever, chills, nausea, vomiting, muscle aches and pains, tachycardia, which is a heart rate greater than 100 beats per minute, photophobia, which is an intolerance to bright light, phonophobia is an intolerance to loud noises, seizures, positive Kernig sign, positive Babinski sign, opisthotonus is spasms of the muscles causing backward arching of the head, neck, and spine. Meningococcal meningitis can have a red macular rash. Viral meningitis can have abdominal and chest pain. Diagnosing meningitis can be difficult. A lumbar puncture may be performed to analyze the cerebral spinal fluid. A lumbar puncture results for bacterial meningitis will look cloudy or turbid. The white blood cell count will be elevated and have raised neutrophils. The red blood cell count will be normal, protein will be high, and glucose will be low. Viral meningitis lumbar punctures will have a normal appearance. Cerebral spinal fluid is normally clear to colorless. The white blood cell count will be elevated with raised lymphocytes. The red blood cell count will be normal. The protein will be normal to high, and glucose levels will be normal to low. Nursing considerations for a lumbar puncture include educating the patient on aseptic or sterile technique. They will be positioned to allow access to their lower back. The fetal position is common. After the procedure, the patient will need to stay on bed rest for a short period of time. Verify that the patient has been educated about the risks and benefits of the procedure. Afterwards, assess the patient for fever, chills, stiff neck, drainage from the insertion site, severe headache, or numbness and tingling below the insertion site. A lumbar puncture can decrease intracranial pressure, so it should not be performed when the cause of increased intracranial pressure is unknown. Blood tests may be performed, such as a complete blood count, or a CBC. A C-reactive protein will be elevated if there is inflammation in the body. The normal range is less than 1. Cultures and sensitivities may be done with blood, nasal swab, or urine. Procedures such as brain scans, MRIs, CTs, and chest x-rays are commonly conducted. The counter-immunoelectrophoresis is a technique that uses electrical current to evaluate an antibody's binding to an antigen. It is used with viral or parasitic infections. Positive Kernig's and Babinski sign indicate nuchal rigidity. A positive Krennig sign is when the patient lays supine with the hips flexed at 90 degrees. The patient will experience pain when the legs are extended. A positive Brunetsky sign is when the hips and knees involuntarily flex when the neck is flexed. Meningitis can cause irreversible damage and may be life-threatening. The patient may develop blindness or deafness. They may develop cranial nerve palsies in which the eye movements are affected. Ataxia is lack of coordinated movement, seizures. Sepsis is a severe infection that can cause death. Systemic inflammatory response syndrome, or SIRS, is a systemic response to severe inflammation or infection. Tachypnea, high fever, and tachycardia are all symptoms. Disseminated intravascular coagulation, or DIC, is a condition where excessive blood clots form throughout the body. Symptoms include shortness of breath, confusion, and pain. Increased intracranial pressure is due to swelling of the brain. It can lead to herniation. Keep in mind that patients with meningitis are very ill. Treatment of meningitis depends on the type of meningitis the patient has. Viral meningitis treatments include bed rest, reduction of stimulants, possible fluid restriction. The patient may need to be placed on seizure precaution. Medications such as phenytonin and diazepam may be used for seizure precaution. Corticosteroids may be prescribed to reduce inflammation. The osmotic diuretic mannitol is used to decrease intracranial pressure. Acetaminophen or NSAIDs are used if the patient has a fever, as well as for pain relief. Headaches are associated with meningitis. If the patient has meningitis related to herpes, the antiviral medication acyclovir may be used. Treatment of bacterial meningitis includes antibiotics. It is normally intravenously and may be weeks of treatment. They may also need bed rest, fluid restrictions, and reduced stimulations. Fungal meningitis is treated with the antifungal medication miconazole or fluconazole. Parasitic meningitis is usually treated with anthelmintic drugs. Nursing considerations for meningitis include knowing about lumbar punctures. The patient may need education regarding the procedure, or as a nurse, you may need help during or after the procedure. If the patient has bacterial meningitis, the patient will need antibiotics. Some things to keep in mind is that the patient may need a central line, they will need routine blood monitoring, and they may need education on the side effects and allergic reactions to antibiotics. The most frequent antibiotics used are penicillins and cephalosporins. Keep in mind that antibiotics are used on bacterial infections. Don't get tricked on a test about giving antibiotics for viral meningitis. Remember that inflammation in the brain can lead to altered level of consciousness. Frequent neurological assessments need to be conducted. Other assessments include blood pressure, heart rate, and especially temperature. The patient may need to be on bed rest and reduced stress. Visitors may need to be restricted, both due to the reduction in stimulations as well as the reduction of risk of infection. Meningitis can be contagious, but the patient may also be at greater risk for developing another infection due to their compromised immunity. Measure the head circumference to detect swelling. Increased intracranial pressure, or ICP, can occur with inflammation. Some things to keep in mind with ICP is that the patient may need mannitol, cerebral spinal fluid drainage, and frequent monitoring. The patient may need to be placed on a fluid restriction to help decrease swelling. The patient may need pain medicine for their headache or their nuchal rigidity. Swelling can cause seizures. Protect the patient by patting the sides of the bed, making sure the bed is in the lowest position, and stay within arm's reach when the patient is out of the bed. Phenytoin and diazepam are medications used for seizure prevention. The patient may need visual or auditory testing to make sure they have not developed any defects. Isolation precaution may include droplet, which is mask, gown, and gloves. Dexamethasone is a corticosteroid that reduces inflammation. Osmotic diuretic mannitol is used to decrease ICP. It's seen a lot on tests, so be familiar with it. Patient education may include medication administration, including dosing and side effects. There is a meningococcal vaccine that should be given at age 11 to 12 and a booster shot at age 16. Inform the patient of the risk of spreading the disease. Visitors may need to be minimized. They also may need to be on isolation precautions. Educate your patient and their family members on the importance of hand hygiene. Inform them that their close family members may need to be on prophylactic treatment. Ensure that they know the signs and symptoms of infection and to report them to their provider. Educate them and their family on signs of increased intracranial pressure. They may include changes in orientation, level of consciousness, and severe headaches. Thank you for listening to this episode of Nursing Survival. Find more study guides at nursingsurvival.com. I also have videos on YouTube. Send me any topics you'd like to hear. Sign up for my email so you can be the first to know when more study guides are coming out. Thank you.